And it's time now for our In Focus Health segment, and we're joined by, of course, Lino Madu. And Lino, you have some interesting information today about the concept of kangaroos and cuddling.
Absolutely. In South Africa, hospitals are encouraging mothers to cuddle their newborn babies in an effort to improve the survival rate of low birth weight infants. It is called Kangaroo Mother Care, or KMC, and benefits mainly preterm babies. KMC is said to be one of the most effective ways of reducing newborn death in the world today. The practice was first developed in Colombia. It has now been adopted by many countries in Latin America, Asia, and Africa. Kangaroo Mother Care was introduced to South Africa in 1995, and mothers admitted at the Somerset Hospital in Cape Town are being encouraged to hold their baby against their bare skin.
Kangaroo mother care is the physical contact between a mother and a baby. It should start immediately after birth with all well babies and all stable premature babies. It should continue at home once the mother and her baby is discharged from the hospital.
The program has the greatest impact in the first week of premature baby's life, when deaths are likely to occur. Last year, researchers from Save the Children reported a 51% reduction in newborn mortality when stabilized babies weighing less than 2,000 grams received body warmth and breast milk. The practice helps increase mother's breast milk and improves the bond between mother and baby.
The kangaroo mother care is different. Like your baby is closer to you, and he's growing fast. You see, it's unlike the incubator, because the incubator is just there, but you as a mother, you're bonding with your child.
At least 3.6 million newborns die worldwide every day. 3 out of every 4 newborn deaths occur in South Asia and Sub-Saharan Africa, where there is a critical shortage of skilled health workers and equipment. Yet, health experts say most of these newborn deaths are preventable. Kangaroo Mother Care helps maintain a baby's body temperature and regulates its breathing.
Normally with the premature babies, they have respiratory problems, but with Kangaroo Mother Care, the respiration improves, and the babies sometimes in the past they had apneic episodes and periodic breathing, but with Kangaroo Mother Care, those episodes are far less than when the baby was in an incubator.
Save the Children says Kangaroo Mother Care cuts in half the risk of infection compared to incubator care. South Africa's Department of Health has already made it a policy that every hospital with a maternity wing should adopt KMC in its program. Joining us now on the phone from Baltimore, Maryland, is Dr. Harshad Sanghvi, Vice President and Medical Director of JPIGO, an organization focused on responding to the changing needs of women and families. Dr. Sanghvi, welcome to the program.
Thank you.
There has to be more to it than just the warmth of the baby. When we look at preemie babies and what they need, they seem so fragile. What is this mechanism? How does this work?
I think there are 2 particular principles that preterm babies suffer from. One is ability to maintain their warmth, and the other one is to be fed when they need it. And Kangaroo Mother Care provides both of those very, very important ingredients for survival, being able to be kept warm all the time. Preterm babies just cannot maintain warmth on their own. So being in contact with the skin of the mother, or in fact the skin of the father, provides them that warmth. And being in contact with the breast at any time provides them with the feeding that is needed. And I think these 2 ingredients are most critical for survival of preterm births.
Interesting that you just mentioned the warmth of the father as well, which means that also the fathers can do that. Now, tell us, can this method fully replace an incubator in the long run, maybe?
Not completely. I think for the very, very low birth weight babies, you still require the incubator. But we're talking of preterm births who are stable, who have no breathing difficulties, and that's about more than 3/4 of preterm babies are like that. Those ones can be helped with Kangaroo Mother Care.
Now, your organization has been promoting this, this approach in countries in sub-Saharan Africa. How this being addressed, how this being really embraced?
Right, Jepaigo has been working in many countries in Africa, and I think it's quite amazing that health workers are so eager to use this in those countries. One of the really amazing things about Kangaroo Mother Care is that it can not only, it's not necessarily only to practice in facilities, it can be practiced right there at home and in the community. So I think it gives hospitals and communities a new mechanism by which they can save newborn lives.
At what point does a mother need to stop?
Need to start? Yes.
To stop the methods.
Oh, absolutely. I think once the baby is feeding on its own and has gained sufficient weight, so when they reach more than 2,000 grams, which is then no longer low birth weight, then the baby is able to maintain its own warmth.
And obviously this is gaining ground in Africa?
Absolutely. I think it is a very, very appropriate method for all parts of Africa to take care of the many, many preterm births that exist there.
Thank you so much, Dr. Sangvi, for joining us.
Thank you.
And that was Dr. Harshad Sangvi, the Vice President, Medical Director of Jepaigo.
Amazing.
Indeed.
Really interesting
really amazing
concept. Well, thank you so much. Lenore Madu joins us every Tuesday and Thursday here on In Focus, always with the latest health news.